Hello everyone, welcome back to NK Tips and welcome back to our weekly health tips series. So today we want to discuss urinary tract infections, okay, which is very common to most of us. Most of us know it as UTI. Yeah. So what is UTI? UTI is simply a condition where you have bacteria growing in your urinary tract, which is not supposed to be the case. Okay, so if you have bacteria growing in your urinary tract, you have a case of urinary tract infection. So depending on the location of the growth, UTI may include pyelonephritis, cystitis, or urethritis. Okay, so that is basically to sum up what UTI is all about. Okay, so what are some of the symptoms that you see that should point out to a possible UTI? So first point of call, let's see how your urine can tell you if there's a possible UTI ongoing. So let's see an abnormal urine and a normal urine, how they both look like. So a normal urine, depending on how someone is hydrated, if someone is taking enough water, the person is going to produce a urine that is colorless to straw colored. Okay, if you are taking more water, and if you are taking less water, you are likely to produce urine that is amber in color. Amber is the yellow color that we have in the traffic lights. Okay, so depending on how hydrated someone is, you may produce urine that is colorless to straw or an amber colored urine, which may be normal. Okay, yeah, and in terms of odor, a normal urine should be almost odorless. It should not have any kind of odor. Okay, it should be odorless for a normal urine. And in terms of appearance, a normal urine should be clear to hazy. Okay, that is for a normal urine. And looking at abnormal urine has so many things ongoing. Okay, maybe a pathological situation ongoing, and your urine is trying to tell you that probably there's something ongoing in your body. Okay, so for an abnormal urine, there are so many things that can bring about an abnormal urine. So one thing is, before I chip into the abnormal urine, there are some factors that can change the color of your urine, but they might not point out to any pathological situation. Okay, so something like if you are taking certain medications or certain diets. Okay, if you are taking beetroot, if you are taking carrots, it may impact the color of your urine. And if you are taking medications, example is if you are taking a medication that contains vitamin B complex, you may produce a urine that looks bright yellow, and that doesn't necessarily mean there's something pathological going. It's just because you are taking that medication that that is producing that kind of color, which at the end of the day impact the color of your urine. Okay, so that is for normal urine. And you have abnormal urine where you have so many things going on in the body that tends to pop up in your urine, trying to tell your body that there's something wrong. Okay, so there are situations like example is the case of liver damage. If you have a liver damage and bilirubins are spilling into your urine, you expect that you produce a urine that is dark brown in color. Okay, so that should give you an idea that there's something going on in your body. So a dark brown urine is an abnormal one because probably there are some bilirubins in there. And then in the case of blood finding its way into your urine, that's the case of hematuria. It is a pathological situation telling you that there's something wrong because blood is supposed to be filtered out. It's not supposed to pass into your urine. So once it is passing into your urine, there's something definitely going on wrong in your system. All right, so in that case, your urine might look pinkish to red. Okay, if blood is spilling into your urine. And in the case of UTI, you may have a pungent smelling urine because of the growth of bacteria. They tend to produce gases as they feed. Okay, so you may have a pungent smelling urine, and you may have a very cloudy looking urine in terms of appearance. Okay, because of the proliferation of bacteria in your urine. Yeah, so that is basically some signs that you can see in your urine that should point out to a UTI. There are some other signs like painful urination or rectal pain, mostly in men, and then frequent urge to urinate. Okay, those are signs. And in some extreme cases, you may feel nauseous or feel feverish. Okay, if you have UTI ongoing. So what are some of the risk factors? So one thing that you should note is that women are very prone to UTIs as compared to men because of how short their urethra is. Okay, it means that your vagina is very close to your anus, and we know the anus harbors a lot of microorganisms because of the role that they play in the GIT. So because of how short the urethra is in women, it is easy to pass bacteria from your anus to your vagina. Okay, so if a woman pees and then doesn't clean in the correct way, that is from front to back, and then you tend to clean from back to front, you may end up transferring bacteria from your anus to your vagina, and once they get there, they become injurious to you. They may produce an infection in that area because they are not supposed to be there. Okay, so women, that makes women more prone to UTIs. Men have relatively longer urethra, making it less likely to have a case of UTI. But men do have UTIs. Yes, men do have UTIs also. And then also another risk factor is diabetes. You know, in the case of diabetes, when the sugar is so high in the blood, it overwhelms the kidney and they end up getting into your urine. And once there's sugar in your urine, it tends to become a breeding ground for bacteria. Okay, they have food to eat, let me say. So they tend to grow in your urine and may cause a UTI for you. And also in diabetes, cases where there is loss of sensation to your bladder, that's in the case of diabetic neuropathy. Okay, your body is not able to communicate to your brain that your bladder is full, so you have to empty it. So you tend to have a lot of urine in your bladder. Okay, not knowing how to empty it. So once you have a lot of urine in your bladder, it's also a breeding ground for bacteria to grow. All right, so in the cases of kidney stones, if someone has kidney stones, it makes it difficult to pass urine, or once the stones are lodging there in your urethra or anywhere it is, it provides a breeding ground for bacteria as well. So if you have kidney stones, you're at risk of having UTIs. Okay, and then in cases of enlarged prostate in men, okay, it's also a risk factor. So what are some of the complications if UTI is not treated? As I mentioned earlier, pyelonephritis is a worst case scenario. Okay, you may have a kidney damage if you have bacteria growing in your kidneys. Okay, and this can lead to a permanent damage of your kidneys. Okay, you may also have a case of sepsis. That is, if bacteria is growing so much in your system that they get to your blood. Okay, you may have a case of sepsis, and if it's not treated, you can have a septic shock and you just go off. Okay, just because of a simple UTI that you could not control. And then if you are not able to control your UTI, you may end up having antibiotic resistance. That's the UTI is recurring. You may have antibiotic resistance because bacteria, they also want to thrive. Okay, so they tend to change so that they are able to resist antibiotic that you take. Okay, so that they can still stay in your system. Yeah, so let's look at some of the prevention strategies that we can use to prevent UTI. So as I discussed earlier, take particular note of how your urine looks like. Know how a normal urine should look like. Once you sense that your urine is smelling in a particular way, okay, and if you're not on any medication, you're not on any diet that can produce that smell, then you should be wary. You should have some labs run for you. Okay, you should have someone take your urine and check for the case of possible UTI for you. So that's the first point of call. Look at how your urine looks like. Okay, particularly the smell of your urine. Okay, and then again, try to drink as much water as you can, because if you have bacteria going in there, the more you pee, the more you are able to flush them out. So you need to take more water so that you are able to pee a lot and then you flush them out. Okay, and then this point, try to urinate after sexual activity, which I'll not go much into. So try to pee after a sexual activity, sorry. And then, as I mentioned earlier, for women, you have to wipe from the front. When you pee, wipe from the front to the back, not the opposite. If you do the opposite, you are transferring bacteria from your anus to your vagina. So wipe from the front to the back, from the vagina to the anus. Okay. And then try to wear breathable underwear. Okay. Do not wear very tight underwear, because if you do that, you provide the conditions for bacteria to grow. Most bacteria are anaerobes, okay, facultative anaerobes, okay, so they like that condition. So once you make the place very tight and there's no air, they're able to proliferate very well. Okay, so try to wear loose underwear, okay, and then avoid prolonged catheter use. Okay, so this is for anyone that is on catheter. Try as much as possible to change it if you can. Okay, so this brings us to the end of today's video. If you find it useful, try like the video, share to your friends so that we all keep healthy. Okay, so see you another time. Bye.